Welcome. This is Richard, and I want to welcome you to the Innovation Best Practices episodes, where every single one is designed to help you sell more and make more with proven, practical innovation best practices that I believe can work for just about any business with any innovation need. I want to give a special welcome to our listeners around the world in 80 countries. Welcome. Today's episode is going to focus on some best practices from the medical business. And you can see these episodes in two different ways. See and hear, I guess, is probably the best way to say it. You can watch them on YouTube with our VideoCast, where the audio track is the same as the podcast, but you get more visuals there, PowerPoint presentation and that sort of stuff. To find that, all you need to do is go to YouTube and in the search bar put in Richard Innovation Best Practices. We'll be down there on the search results list. Click on it and you'll see all the currently available ones. You can also listen to this as a podcast. You can go to my website, i2ge.com. That's the letter I, number 2, ge.com/podcast. You can also listen to the podcast on iTunes by searching in the podcast section for Innovation Best Practices. If you go to iTunes, would really appreciate it if you could give us a 5-star rating and review. What this does within the iTunes systems is make it easier for other people to find the Innovation Best Practices podcast, because your ratings and everything have a lot to do with the ease with which you can find it. Let me just quickly read you a rating and review, a couple of them that we've had so far that I'm very, very grateful for. First 5-star rating headline says, great series. I've been following this series of podcasts and I find them to be insightful and extremely relevant. I hope to use some of Richard's ideas in my own business. Highly recommend it. Next 5-star rating, the headline says, easily 1 million plus free actionable advice. 1 million. I should maybe charge for this. Instead of it all being free. And it goes on to say, I've been working with and learning from Richard for years. These podcasts capture the best tactics and principles he's learned over decades of successful innovation work, plus many new tactics he's continuing to develop. He's a doer and a teacher, a rare combination indeed, and one that makes it easy for us to quickly benefit from his wins and wisdom. Wow. Well, I want to thank the person who gave me that review. Very, very much appreciated. We also have a free Innovation Best Practices app for the iPhone and iPad in the App Store and for Android devices in Google Play. So you've got a free VideoCast, free podcast, and free apps. No excuse for not listening. And I love hearing from listeners, so you can contact me by just emailing me directly at richard@i2ge.com. So I look forward to hearing from you. Today's episode is about Sanofi-The Company, which is a French multinational pharmaceutical company, primarily prescription drugs, but also OTC, which is over-the-counter. It's a pretty darn big business, 34 billion euro in sales and 23 billion euro in profit. Major product lines include cardiovascular, infectious diseases, metabolic, neurology, oncology, and pain. A lot of their growth strategy has been strongly based on major acquisitions, but they've turned a significant amount of their growth objectives and achieving those growth objectives through innovation. Dr. Rapaki, their innovation and medical director, commented on the, quote, tsunami of change, close quote, in healthcare worldwide. And that's probably not an understatement. It's one of the most dynamic, changing businesses out there with insurance programs and new technologies and everything else going on. And they faced, quote, amazing opportunity and potential risk for our business model, close quote. So their ramped up desire for innovation is really motivated by a rapidly changing healthcare world that represents some potential risk to the current business model. And if there's risk to your business model, which is how you make money, there's a risk to the overall viability of the business. And major industry changes are causing the need to consider radical shifts in strategy. His response, he said, open quote, "I had a large medical department, so I said, let's do it. Let's commit headcount to innovation and see what happens." Close quote. Not the strongest, I guess, commitment to innovation that I've ever seen, but I like the spirit of let's do it. In the beginning, they decided to take a lean startup approach and what I'll call an entrepreneurial approach, which is what business is. Whoever came up with this term is just kind of a bit crazy to me. But anyway, it's kind of like you want to have entrepreneurism inside a company, so you call it entrepreneurial. Okay. Regarding this approach, he said, open quote, "It has all the challenges of a lean startup in terms of runway and number of people involved, etc. We stretched our capital at the start as far as possible. If we fail early and smartly so we can learn. We try to change the model in terms of how we partner to innovate." Close quote. A number of good things going in innovation best practices in this particular statement. If you fail early and smartly so you learn from your failures. That attitude and recognition that you're probably going to fail. If you are, fail early. And if you do fail early, learn from it. It's a very good innovation best practice. Internally, he faced both size and silo challenges. Silo challenges is where finance doesn't speak to marketing, doesn't speak to R&D, et cetera, those sort of silos. They decided to not focus on small and evolutionary changes. They wanted to deliver transformational benefits. They wanted to create new standalone business units out of these products with transformational benefits. Now we're getting some nice aggressive goals in here. Much of their focus was on areas where everyone else was not working on, which is an interesting approach. His noble purpose was he wanted better health, reduce inefficiencies, to cut costs and increase value. I love the increase in value, and improve the personal experience with the medical world and medical treatments. Quoting, "Unless any program I work on ticks all three of the boxes that I just mentioned, then it's not where my passion is or where I want to be." So better health, reducing inefficiencies and creating better value, and improving the personal experience. He went on to say, quote, "The healthcare industry is about feeling great and living fulfilling lives. So when you frame it that way, everything you do seems logical and not tangential to your current business," close quote. Their focus became very patient-centric. They wanted to understand the larger context of the patient interface with healthcare and products. He said, quoting, "You start to realize that there's a lot more to an individual than just the minute of the day that they're taking your medication," close quote. I love this. I mean, this is looking at the broader context of what's going on in a person's life, not just that small amount of time that they're actively interacting with your product. This kind of perspective can reveal a lot of insights. He went on to say, quote, "We asked them about their experience of living with disease or managing sick kids or taking a vaccine that didn't work and traveling and getting sick. There's ways to touch people's lives, and that became the impetus for change in the organization," close quote. I love that. Big learning component here. Learning component going beyond just facts, figures, and the chemistry of the particular products they were using. There was also a separate Sunrise initiative in another part of the company, headed up by Global R&D. I'd been talking about the Innovation and Medical Director initiatives up until now, and now I want to talk about an initiative by Global R&D within the company, and they called it their Sunrise Initiative. And this is very interesting because it involved extensive partnerships with venture capitalists and entrepreneurs. They focused on very early stage innovation and they moved into a process of co-creation with companies that were already supported by venture capital and financing new companies where appropriate. So they contributed shares and resources to these venture capital startups and new companies to collaborate in co-creation. It turned out to be a much more attractive alternative versus creating a very large internal capability. And I'd really underscore this. This is a smart way of doing innovation. You don't need to always build, and when it comes to innovation and you're concerned about protecting intellectual property and all that sort of stuff, you really don't need to build up necessarily large internal capabilities. You can partner with external companies like they're doing here in their Sunrise initiative, and it's a great way of getting access and diversity into the creative and innovative process. They worked on all kinds of things from in these collaborations with venture capital and new companies, from type 2 diabetes to asthma, vaccines, Alzheimer's, antimalarial, rheumatoid arthritis, and that sort of stuff. So broad program of R&D under their Sunrise initiative in working with outside companies and all of this. I think there's a lot of best practices here. I've talked a little bit about it, but it's learning about the broader context involved with customers' use of your products before, during, and after. So I've talked about it a little bit here in terms of a medical context, but I really want anybody listening to this. For example, if you're in the business of selling power saws, boy, you can put a microscope on those few moments where the person has the power saw in their hand and is using it. But if you also just kind of back up to understand the broader context of what they were doing before, the preparation and all of that, and then the time after the use of it, not just focused on the power saw, but other sorts of habits and practices that people are doing, you can gain a lot of insights. Not every one of these insights is going to, create the innovation breakthrough of the future, to be very clear. But you want to understand the process that people are doing. And I've had an earlier episode focused on all the steps involved in a process. And this is just another way of kind of looking at that and saying, look more broadly than just the few moments that a person uses your product, and you'll find potential insights there that can lead you to some very positive places. Next, this partnering with external enterprises, especially startups and new ventures, where there's a match in overall business goals. The diversity and additional capabilities can absolutely speed up the process and produce better results than doing it internally. So I think both of these are very good practices that kind of come out of this example. So I hope this helps. If you'd like more innovation best practices, we've got a lot of ways we can help you. You can just go to my website, i2ge.com, the letter I, the number 2ge.com. On the left-hand side, you'll see the DIY innovation training on the menu bar, do-it-yourself innovation training. Click on it. You'll see a whole bunch of training programs that we have. If you don't see one that exactly fits your needs, email me. We'll be glad to tailor one to your unique needs. Here's what I'm trying to do with this. I'm trying to make you innovation self-sufficient through these training programs so that you don't need to hire expensive consultants like me and others to do it for you. Another resource that you have is one of my 6 books that are published, which is Proven Practical Innovation That Delivers Results. It's available only at Amazon in a paperback and Kindle. I've priced it below my break-even cost and everything, so it's a great value. If you have suggestions, comments, or requests, I love hearing from listeners, so just email me at richard@i2ge.com. The next episode it's a very interesting one. It's why smart people struggle to be innovative. I've actually done a previous episode in and around this, but I'm going to come at it from a different angle on this. But it's why smart people struggle to be innovative. Now, there's many, many, many smart people, I think, listening to these episodes. So I may be talking about you or people that you know. So you may want to listen into this. And since you're smart, learn how you can innovate better in this episode. So I look forward to reconnecting with you then. As you well know by now, I deeply, deeply appreciate you taking time out of your busy day to spend it with me. I look forward to reconnecting with you soon in future episodes. And until then, please, please, please have a great day.